Everyone to the Thermographic Diagnostic Imaging and Health Through Awareness webinar. My name is Leisha and I will be your host. Before we begin, just a little housekeeping. The presentation will last 50 to 60 minutes, followed by a Q&A. You should be able to hear me and the speaker as well as follow the PowerPoint presentation. To the right of your screen, you'll see a chat box. If you have a question, type it in and submit it, and we'll get to as many questions as possible at the end of the presentation. If for some reason we don't get to your question, please forward it as an email to tdi@comcast.net. If for some reason you get cut off from the webinar, you can try to log back in and fast forward to catch up, but don't worry, the presentation will be archived in a day or two and can find it again on our website at www.tdinj.com. So it's my great pleasure to introduce our speaker this evening, Dr. Philip Getson. He is filling in kind of a last minute. Our scheduled presenter, Kate Moss, unfortunately had a unforeseen circumstance and she was unable to do the webinar, and we're hoping that maybe we can get her back in 2017 because we had lots of interest in her presentation. So just a little bit about Dr. Getson. Dr. Getson is a family physician in practice since 1976 in New Jersey. He is an internationally recognized expert in the diagnosis and treatment of reflex sympathetic dystrophy, also known as complex regional pain syndrome. He's lectured extensively on this subject in this country and overseas. In addition, he serves on the Scientific Affairs Council of the Reflex Sympathetic Dystrophy Council of America. Dr. Getson is also an assistant professor of medicine and neurology at Drexel University Hospital in Philadelphia, board-certified thermologist, and has reviewed more than 20,000 thermographic studies of the breast, thyroid, and neuromuscular system. He's been certified by 4 thermographic boards and has lectured internationally regarding thermographic testing, having authored several papers on the subject. He has recently completed a 3-year term as Vice President of the American Academy of Thermology, where he was responsible for authoring the breast protocols currently in use in the national and international thermographic communities. So it's safe to say that you have been a proponent and advocate fighting the fight for thermography for many, many years. Welcome, Dr. Getson.
Well, thank you very much. And every time somebody reads that bio and says you've been in practice since 1976, I don't want to look in the mirror anymore because it makes me realize that unless I started when I was 11, it's been a long time.
It's been 40 years, right?
40 years.
40 years.
So I'm glad to be here, and I'm glad to be able to fill in, and I'm glad to be able to talk to the audience and give them some new information, both about mammography and about thermography. And I'd like to let the listeners know that this PowerPoint that they're seeing and hearing tonight is actually the PowerPoint that I'm going to be presenting in Atlanta in early November to the American Functional Medicine Association, where I'll be lecturing to that group on thermography and its implications not only in breast disease, but also in neuromuscular and thyroid dental issues. So this is sort of a run through and a chance for me to talk to a group of mostly knowledgeable individuals about thermography, but also to give them some information about mammography so that those who go to doctors and say you should have a mammogram, I can explain to them quite simply why that is no longer the case. And I think that they're going to look at the data. Perhaps they'll download the data off the archive and be able to go in armed with a intelligent dialogue to the doctors and say, this is what is in the medical literature. Why do you keep telling me that I need to have a mammogram? So we'll start with this, which is one of my favorite slides. And normally when I have a group of people sitting in front of me, I ask this question at the beginning of my discussion. I ask the women in the audience, how many people by show of hands have had a mammogram? And generally, virtually every woman will raise her hand. And then I ask, how many of you have found it a pleasant and enjoyable experience? And in 32 years of doing thermography, I've never had a hand raised yet. So I think that speaks volumes for how women feel about mammography. That being said, this is a wonderful explanation or symbolism, as it says, of the female breast. And I'm not going to read it, but I'm going to allow everyone listening to the webinar to just enjoy reading this.
I think I don't want to interrupt if people are reading, but it does say so much about, as a thermography technician, I hear all kinds of sometimes unfortunate remarks about how women feel about their breasts. And so I would really encourage them to, the next time they're thinking those negative things, to look at their breasts in this view, and just, send positive, loving thoughts to their breasts.
Okay, so
Okay.
moving forward, there are a lot of slides here. If I go quickly through some of the slides, again, this will be archived. You'll be able to go back and look at it with more time spent and really digest it a little bit better. So in 1928, uh, which was 40 years before mammography, Dr. Quigley, who was a physician and director of the Radium Hospital in Omaha, Nebraska, studied 6,000 cancer patients and wrote an article in Radiology, which is the Journal of X-ray Doctors, saying, "Be careful how you handle cancerous breasts for fear of accidentally disseminating cells and spreading cancer." Before the first mammographic equipment was introduced, there was already concern on a pioneer in the field of evaluating breast cancer as to the possible detrimental effects that could be caused by the way that breasts were handled. Who was assistant clinical professor of immunology at the National Cancer Institute, said mammograms increase the risk for developing breast cancer and raise the risk of spreading or metastasizing, which is spreading existing growth. And he said that since mammographic screening was introduced in 1983, which is not completely accurate, it was actually introduced a little bit earlier than that.
Dr. Getson, you're kind of blipping in and out here.
Oh, okay. Is this any better?
Yes, that's much better.
Okay. 12% of all breast cancers had increased by 328%, which they felt was in large part due to the use of mammography. And the last line, the increase for women screened mammographically under the age of 40 has gone up by 3,000%. And that's not a typographical error. In 2005, the National Toxicology Program classified gamma radiation or X-rays or mammograms as known human carcinogens. And Mike Adams, who does wonderful counterthink cartoons, came up with this one, which I think puts it really in a very good perspective.
Sure does.
So compression of the breast, because we talk about radiation, and sometimes I think we forget about compression. And Dr. Hoekstra said 22 pounds of pressure is sufficient to rupture a capsule around a cancerous tumor. And today's mammogram equipment uses the equivalent of 42 pounds of pressure, which, as you see in the corner, is the equivalent of laying 3 bowling balls on the breast. So if you can't understand the concept of 42, the concept of 3 bowling balls on the breast would make a woman, and a man for that matter, cringe.
Yes.
In 2009, the U.S. Preventative Task Force breast screening recommended changing the policy on mammography, stating that rather than benefiting from screening, women with cancer may incur harm undergoing mammography, additional imaging, and biopsies. And in 2011, the British Medical Journal said breast cancer screening may cause women harm, especially during the early years after they start screening, due to surgery, lumpectomy, mastectomies, and other often unnecessary interventions. So I want to point out that this is coming from the United States government. This is coming from the British Medical Journal. This is coming from the New York Times. And as you will see moving forward, from very prestigious medical journals like the New England Journal of Medicine. The Nordic Cochrane Report is a report that comes out of the country of Norway, and the Cochrane Center is a group of individuals who collect data and take that accumulated data and present it in forms that individuals can understand and appreciate. They rarely offer opinions. But in this case, they did. They said if 2,000 women were screened regularly for 10 years, the number that would benefit to avoid dying from breast cancer was one. That's one woman in 2,000, one woman in 20,000 mammograms. They further said that 10 healthy women would at the same time undergo unnecessary harm because they would have either part or whole of their breast removed and sometimes receive radiotherapy or chemotherapy. Further, 200 women of that group would undergo false alarms because of the psychological strain of not knowing whether it was cancer or not. And I think that what is eliminated or overlooked, if you will, is the psychological strain that, hey, come back and get some more pictures taken because we're not sure what we're seeing does to people. You know, we know the physical harm of radiation, we know the physical harm of compression, but we rarely talk about the psychological harm of the not knowing. The conclusion of the Nordic Cochrane report was it therefore no longer seems necessary to go to breast cancer screening. And in fact, by not going, you will lower your risk of getting a breast cancer diagnosis. Further, in the study, a further study in Norway analyzed data from 40,000 women over a 9-year time frame. And they said that with the introduction of mammography, the reduction of breast cancer treatment was 10%. 8% were women who didn't undergo screening. So the conclusion was that the reduction of breast cancer was 2 patients in 100,000 women. I mean, these are staggeringly low numbers. And the 2% advantage was offset by the carcinogenic effects of mammograms. Further stating breast tissue is known to be highly susceptible to cancer. So what they're saying going backwards, 2 patients in 100,000 was a reduction, but that 2% advantage was offset by the fact that they acknowledged the carcinogenic effects of the radiation of mammography. In 2010,
Although we would be led to believe that the numbers are much higher than that.
and that's exactly what is correct. We are led to believe that mammography saves lives. And research studies in this country, and as you will see throughout the world, really show quite to the contrary. This is a study that came out from Berkeley that said that radiation exposure from mammograms can alter the environment surrounding the cells so that future cells that develop in the natural progression of life are more likely to become cancerous. This is one of my favorite opinions. Dr. Otis Brawley, who was the chief medical officer of the American Cancer Society, said mammography is not a very good test for younger women. It's very difficult for a mammographer to pick up cancer in the breast of a woman in her 20s, 30s, or 40s. I think we need to support some of the research in the many things like thermography that might actually be a better imaging study than even mammography. Now, I doubt that anyone saw this. But
did this go anywhere? Did anything happen because of this?
To the best of my knowledge, it did not. This was on public radio, and it never got any farther than this. In the Journal of the American Medical Association, in 2009, it said for every breast cancer death averted, even in the age group of 50 to 70, 838 women undergo screenings for 6 years, generating thousands of screens, hundreds of biopsies, and many cancers treated as if they were life-threatening when they are not. That's another point worthy of note at this juncture, which is that not every breast cancer needs to be treated, and not every breast cancer is life-threatening, as you will see moving forward.
I think that's such an important point because the whole breast cancer, there is so much fear around cancer in general, but there seems to be so much fear about breast cancer as opposed to any other cancer. And there's so many industries that are built around the fear of breast cancer.
I agree with you entirely. I mean, it's come do this, come do that. You have to do this, you have to do that. And it becomes paramount in one of the slides that you're going to see that We added on at the last minute here. In 2011, a breast surgeon said 30% of all tumors would go away if you did absolutely nothing. The New England Journal of Medicine, this is perhaps the largest study ever done in this country. Two doctors studied 100,000 women from 1976 to 2008, 32 years of analyzing mammography. And at the end, they said that 1.3 million women in the United States in 30 years were overdiagnosed, that had tumors that would never have led to clinical symptoms. We're not talking about death now. We're talking about being sick from the tumor. And in the year 2008 alone, more than 70,000 women were overdiagnosed.
Wow, that's unbelievable.
And Dr. Welsh, an internist at Dartmouth Institute, concluded that few breast cancers are destined to kill no matter what we do. British Medical Journal studied the Canadian National Breast Screening Trial and said pretty much the same thing, that women were overdiagnosed. 22% were overdiagnosed, representing one overdiagnosed breast cancer for every 424 women who were analyzed in the study. And Dr. Brawley, now remember, Dr. Brawley was from the American Cancer Society. We talked about him earlier. Explain what they meant for overdiagnosis: a tumor that fulfills the laboratory criteria to be called cancer, but if left alone would never cause harm. This is a tumor that will not continue to grow, spread, and kill. It is a tumor that can be cured with treatment, but does not need to be treated and or cured.
Wow.
So one has to wonder if the president of the American Cancer Society recognizes the value of thermography, recognizes the overdiagnosis, and is pretty much saying, think twice before you treat it. Why has this not become common knowledge?
This makes me, or reminds me of the movie The Promise that we watched several years ago, wonderful documentary about, it's called The Promise, and it was the false promise of mammography. And how and it came out of Britain. A fantastic documentary if anybody wants to look it up and watch it, but really kind of connects the dots on how this whole I don't know what you want to call it, this whole cancer industry started with this breast cancer and mammography.
I agree. It was a wonderful, wonderful documentary that I encourage everyone to watch and really pay close attention to. This next study was in the New York Times in 2014. It studied 90,000 women and found that death rates from breast cancer and from all causes were the same on women who got mammograms and those who did not. But the screening had harms. 1 in 5 cancers found with mammography and treated was not a threat to the woman's health and did not need treatment at all. Now, we hear very frequently about dense breast. Dense breast has to do with the density of the breast, and density on mammograms is white on a dark field. And pathology, tumors, are white on a dark field. So Bonnie Rush, who was the president of breast imaging specialists at the Association for Medical Imaging in 2014, said it's like trying to find a snowball in a snowstorm. Simply because you can't see white on white, and if the breasts are dense and there's some kind of tumor or some kind of growth, you're trying to see white in a white background, which is what this analogy means. So the American College of Radiology recognized this, and it said that women with greater than 50% breast density, which, by the way, is virtually 80% of women under the age of 65, the ability of a radiologist to see abnormality that may be cancer takes down to 60% sensitivity. And in 1992, and that's important for the next slide, they recommended that the mammography report begin with a description and an explanation that breasts that are dense are more likely to have less accuracy in the reading of the mammogram. And so they said that there should be a disclaimer, which you see in the red box. And in July of 2014, a bill was introduced by the federal government saying that this should be a part of every mammogram report. Now, what makes this interesting, going back for a moment, is at the bottom there, you notice that in 1992, the American College of Radiology noticed this, and a mere 22 years later, it made it to Congress.
Hmm. Well,
The other thing that's interesting is that this appears on the report that you get after you had your mammogram.
right. Now,
They don't
Dr.
tell
Getson,
you this before.
haven't they changed due to breast density? Haven't they changed the requirements to start at age 50 and do them every other year?
In the report on the front of the New York Times, which was an earlier slide, the recommendation of the U.S. Preventative Task Force was to begin at age 50 and do them every other year. You are correct. And what happened at that
But
point
you
was,
just said I'm sorry, excuse me. You just said that women, you said up until age 65 still have dense breasts, and I have women that I see in their 70s who still have dense breasts.
that is correct. As women get older, the breast density percentage tends to lessen, but you can have dense breasts forever.
Can you explain what that means a little bit?
It,
What does that mean, dense breast?
it has to do with the fullness or the thickness of the breast tissue. It's the best way to describe it is kind of looking in a forest. How many trees are there? And you know that if there's a lot of trees that you're looking through, you can't see from front to back. So that would be the density, and less
Mm.
trees would be, or more sparse, you would have more visualization. It's the same in mammograms. The more dense they are, the thicker the tissue, the harder it is to see anything, because it's obscuring the ability of the radiologist to see anything that may be formed in that area.
So breast density is a normal. It's normal. It's not an issue. It doesn't mean there's anything wrong, because I do have women that say, "Oh, I have dense breasts," as if that means there's a problem. That does not indicate that there's a problem.
That's correct. It is not a problem, and it's actually very, very common.
Okay, thank you.
So, a brief discussion about DCIS, ductal carcinoma in situ. In 2013, 3 years ago, the National Cancer Institute said that the ductal carcinoma in situ should be renamed to take the word carcinoma out, thereby causing less fear in patients. And they recommended calling it indolent lesions of epithelial origin, which, by the way, 3 years later has still not happened. Dr. Esserman at the bottom says this is not cancer, so why do we call this cancer? And Dr. Brawley, the chief medical officer of the American Cancer Society, said we need a 21st century definition of cancer instead of a 19th century definition of cancer, which is what we've been using. And I can't tell you the number of women who come in who have had partial mastectomies, lumpectomies, full mastectomies for DCIS, and it just makes me cringe.
It's terrible.
One of the other things that you hear is that mammography is for early detection of cancer. Well, by the time you can see a tumor on a mammogram, it has been growing for 7 to 10 years. I encourage you to pay attention to those numbers, 7 to 10 years, and has doubled more than 40 times. So here's a cancer growth chart. And you see that at 1 year, the number of cells is 16. And even at 3 years, it's less than 1,000. And at that 7 year mark, it is 268 million cells. So
Wow.
if you can't see a tumor until a minimum of 7 years, it has now doubled and doubled and doubled and doubled. And you now have 268 million cells or more that you're dealing with. When, had you known earlier, it would have been an entirely different story. Another thing that we hear about is 3D mammograms for tomosynthesis. And in Radiology Today, published by radiologists, doctors who read x-rays, in 2011, it says you have to take 2 additional films with a CAT scanner over an additional standard mammogram, and you now have 3 times the radiation of a standard mammogram. Are you seeing in 3 dimension? Absolutely, but at the risk of even more radiation. 2014, the medical board of the country of Switzerland voted to abolish new mammography centers and was actively working on trying to eliminate mammography entirely in the country of Switzerland.
Dr. Getson, could
2000.
I just interrupt for a minute? It's going
Sure.
back a little bit when we were talking about what the radiation does to the breast tissue. Can you just explain why women are being told the radiation is harmless, that it's about the same amount as radiation as you get in the airport? Or,
Certain.
yes.
You get one radiation absorbed dose of radiation from a mammogram, approximately. And you get about the same amount when you go through screening at an airport, as you accurately stated. The difference is that when you go through the screening at the airport, that screening device is about 7 feet high and about 4 feet wide. And that dose of radiation that you're getting is dispersed through 7 by 4 or 28 square feet, approximate number. When you have a mammogram, it is focused on the breast that's about 4 inches by 4 inches. So you're getting the same amount of radiation, but it's not in a 7 foot by 4 foot beam. It's in a 3 or 4 inch by 3 or 4 inch beam. So it is focused radiation, which makes it much more intense and much more harmful and damaging. The other thing is that when you're going through an airport screener, it is screening all of the body from head to toe. And as we saw earlier in one of the slides, the breast tissue is extremely sensitive to the damaging radiation that comes from a mammograph equipment. And so while the radiation may be the same, it's not focused, and it's not focused on extremely sensitive tissue. And the other piece of this, of course, is that when you're going through a screener at an airport, nobody's dropping 3 bowling balls on your head as you go through the screener.
Right. So it's just the compression, then the radiation just adds insult to the injury already with the now traumatized breast. So that
Correct.
those effects have to be very cumulative.
And it's focused directed radiation. That's absolutely correct.
Yes. Thank you.
You're welcome. And in 2015, the country of Norway, that does a lot of research, as you can tell from these slides, pretty much said for every 27 women correctly diagnosed, 142 have false positive readings, and 5 are seen that aren't even there.
Hmm.
You talked earlier about fear, and this is a letter that you handed me this week, and this is an actual letter that was given to a patient who gave this to us.
Dr. Getson, you want to go ahead and read it? Just a reminder that you are due for your screen mammogram. Our records indicate that it has been 1 year. Your last mammogram was in September 2015. You must schedule your mammogram at least 1 year from your last mammogram. Failure to test may result in undiagnosed breast cancer and potential death. That about says it all.
Yeah, I think when you're talking about fear, that's right. This about says it all. So we'll move away from mammography and we'll go on to thermography. And we'll begin by saying it is an indisputable fact that a man invented mammographic equipment. And we know that because had a woman invented the apparatus, it would have looked like this.
Yes. The manogram.
Every time I give a lecture and there's a man in the audience, he kind of shrinks down in his chair, and I sure
Yeah.
understand.
Mm-hmm.
So let's talk about thermography, a non-invasive breast health risk assessment tool, or a heat picture. And for those of you who have undergone thermography, you know that the camera looks pretty much like this, the laptop computer that it's connected to, and there's no tubes, and it's a very non-contact, non-painful, non-fear-based technique. So thermography uses FDA-approved infrared technology to provide an image of the body's physiologic responses. It's totally safe, non-radiologic, non-invasive, painless, with no known adverse effects, no contraindications, and can be used at any age, and provides a screening tool far superior to others in the early stages of some diseases. So I think it's important to mention safe, no radiation, no compression, no side effects, and early stages. Because as you saw earlier, where it says 7 to 10 years, we're now talking about the ability to see physiologic abnormalities of the breast before the anatomy displays a tumor the size of a pencil eraser, which is what mammography does. So in the Norwegian study, it says as cancer cells develop, they take nutrition from surrounding cells, their own blood supply. Once the blood supply is there, cancers grow. And the chemical and blood vessel activity in the area causes an increase in heat. Thermography measures the temperature in the skin surface and the heat signature of the inflammation of cancer growth. And since blood is the main heat exchanging fluid in the body, pathology identified by thermography is generally associated with blood perfusion, meaning that as blood goes to the area will warm. Cancer cells need blood to bring nutrients to grow. The blood brings warmth. The thermographic equipment measures that warmth, and hence you have an early detection of abnormalities. Thermography goes back to 1957, as you'll see in a moment, but in 1963, two McGill, which is in Toronto, by the way, two McGill University surgeons published a study based upon intraoperative evaluations demonstrating skin surface temperature with breast cancer. And this experiment, done 53 years ago, added credence to the research suggesting that infrared findings were related to increased vascular flow and increased metabolism, or in other words, increased cancer cell growth. In 1980, they studied 58,000 women and determined that of 1,527 patients with initially healthy breasts and abnormal thermograms evaluated over a 12-year period of time, 40% of those developed malignancy within 5 years. So after studying 58,000 women who had normal breasts, but abnormal thermograms, 40% of them within 5 years developed breast cancer.
That's staggering.
It is. And for those of you who've seen that quote in the last 3 lines, an abnormal thermogram is the single most important marker of high risk for future development of breast cancer, this is the study from which it came.
Wow.
So this is a breast health assessment tool. And we detect physiology, not anatomy. And the important thing to note here is that in medicine, physiology always precedes anatomy. What that means is that changes of how something works come before how something looks. And I use the following example. Patient comes into my office coughing, wanting a temperature of 104 degrees and really sick. And I listen to his or her chest and I say, well, it sounds like you have pneumonia. Let's go get a chest x-ray. And they go across to the hospital and they get a chest x-ray and the report comes back normal. So the patient looks at me and says, well, how can this be normal? I'm sick. You hear stuff in my chest. I'm coughing up stuff. And the answer is that the x-ray is a test of anatomy. And my listening to the chest is the physiology. And so that patient is sick and manifesting clinical symptoms of bronchitis or pneumonia before the x-ray actually shows that pneumonia. 3 days later, if I re-x-ray the chest, it will show the pneumonia. And 3 or 4 days after the pneumonia is cleared up, it may still show the lingering effects of pneumonia because it just lags behind. So the importance of this is that when you test physiology, you're getting a head start on problems because, as you saw in the slide earlier, 7 to 10 years. And we say to people, thermography will detect physiologic changes in the breast 7 to 10 years before anatomical studies will show that abnormality.
Dr. Getson, are there any other physiologic testing modalities out there like thermography? What it seems that conventional medicine really uses only anatomic testing.
For the breast, there are no other physiologic
Well,
tests.
for any other, what are the other physiologic tests that we have?
There are physiologic tests for nerve abnormalities, electrodiagnostic testing, EMGs for things like carpal tunnel syndrome are more physiologic than anatomic. So, and some of the lesser known, somatosensory evoked potential testing, there are some tests, but none that are applicable to breast disease.
No, I'm not saying that. I just find it interesting as, as long as I've been doing this and I understand physiology and anatomy, I'm wondering if physiology um, predates anatomy by 8 to 10 years in the breast, and I would assume that the physiology in other areas of the body is also the same, would precede the anatomy. So
Correct.
wouldn't it make sense then to have more diagnostic tests that were physiologic in nature as opposed to
It,
anatomic?
it would absolutely make sense. But the
Okay.
reality is that they just don't exist in some fields of medicine,
Okay.
like breast health. Excuse me.
Okay.
So, a really brief history of thermography is that in 480 BC, Hippocrates applied mud over the body and let the mud dry. And the areas that dried first were the hottest areas of the body, because they caused the heat that was emanating from the body caused the mud to dry first. And hence they concluded that there must be something wrong in that particular area of the body. Fast forward about 2,000 years, and you get Ralph Lawson, who was a physician who used diagnostic thermography and found out that skin temperature over a cancer was higher than that of normal tissue. And it really begins, medical thermography begins in 1957 in this country. Interestingly enough, mammography doesn't begin until 1966, when Philip Strax, who was a radiologist, pioneered the use of mammography for a screen for early breast cancer. And we kind of wonder now, knowing what we know 50 years later, how early was early.
Hmm.
But for those who say, well, thermography must be new, okay, it actually predates mammography by almost 10 years. And the subject of thermography actually goes back to the Second World War, when the government used it for spy planes, but medical thermography by 10 years. For those who say this is not an acceptable medical device, in 1972, the Department of Health, Education, and Welfare said that it was beyond the experimental stage as a diagnostic procedure. And 10 years later, the Food and Drug Administration found it helpful as an adjunct for diagnosis in many areas. So a lot of times patients will go to the doctor and you get these, oh, it must be new, it's not FDA approved, et cetera, et cetera, et cetera. And all this is not true. And in 1972, there was a paper written that talked about thermography. And part of what it talked about was the use in the pathology of the female breast.
Well, so what happens? I mean, what happened?
What, what
What
happened?
happened? Why didn't it come to wasn't it accepted or more widely used?
It's a terrific question that is really best explained by this. In 1970, the National Cancer Institute enacted what they call the Breast Cancer Detection and Demonstration Project, and they were going to evaluate thermography. And they were going to compare thermography to mammography and surgical biopsy. So here's what they did. They got some radiologists who had been reading mammograms for 4 or 5 years, because that's all mammography had been around. They got some technicians who were trained X-ray technicians and had been doing mammography for some time. And they got the best equipment that they could get, and they did mammograms. And then they found some people who had no expertise in understanding what a thermogram was. And they got some technicians who had never before done a thermogram. And they got mobile homes or vans that had no airflow. So they had to open doors, letting ambient heat and light in. They had no air conditioning or heat. And they started taking thermographic pictures with no quality control, no expertise in taking the pictures, and no expertise in interpreting the pictures. And wonder of wonders, they concluded that thermography didn't work.
Hmm.
And one study that I read called it a joke, another called it a disaster. And so the conclusion of the National Cancer Institute was it doesn't work, which made all the radiologists happy. Never got restudied because nobody really wanted to fight the fight. But interestingly enough, a few years later, the Council on Scientific Affairs of the American Medical Association met to discuss the role of thermography in breast disease. And they concluded in a preliminary report that thermography had a value, at least in their minds, as an adjunct to mammography. And that report got sent back by the AMA to the Council on Scientific Affairs saying, you need to clarify the report. Well, it was pretty clear. But they said, well, we don't really have anything more to add unless there's more information. They sent it back to the Executive Council of the AMA, who said, well, we think you should study this some more. And they sent it back to the Council on Scientific Affairs, who sent it back to the AMA a third time, who sent it back to the Council on Scientific Affairs, at which point in time, that group of individuals concluded that it was fruitless. And so they said, okay, we need more time to assess the role of thermography. They never said it didn't work. They just said that time will tell what its true value was, because they really got kind of tired of meeting and talking about this and having to send it back to the AMA that clearly was not going to put this through. Now, there's 2 points of interest. One, I actually had conversation with a couple of members on the Council of Scientific Affairs to validate this. And number two, when MRIs were first introduced, they did exactly the same thing. They sent it to the Council on Scientific Affairs, who sent it back to the AMA, and went back and forth. The only difference was, given that this was a study that the radiologists could sink their teeth into, that got pushed through.
The MRI.
The MRIs did.
Yes.
And so the AMA has never validated the role of thermography, but at the same time, they've never negated it. So the reason I believe, and this is my opinion, having been around longer than any other thermographer in this country, is that thermography is truly a threat to the radiologic community, because it works. It has been validated in scientific study. It has been validated throughout the world. Mammography, as you've seen earlier in this dissertation, has been negated, and people are beginning to question about, really, does it work? Is it more harm than benefit? And as a result of all these things, mammographers, whether it's the technicians, the people that sell the machine, the people that sell the plates, the people that read the pictures, really see thermography as a viable threat, not to mention big pharma and the whole cancer treatment industry, not to mention all the surgeons who are doing what really appears to be unnecessary surgery based upon this. So thermography, this kind of little mouse that roared, really poses a threat to a lot of people. And those people have a lot more power and a lot more people working for and with them, and quite frankly, a lot more money to fight this fight. And the thermographers, being about 400-fold in this country, really are not in a position to do anything but just go about their business and hope that more and more individuals jump on board.
I would just like to add something to that. You know, that sounds, it sounds okay. Yes, that's what's happening, and we all see that, we understand that, and it sounds a little bit hopeless. You know, like what can we do? So I would just like to throw out there that there is a fantastic documentary called "The Truth About Cancer." It was done by Ty Bollinger. It's been replayed over the, I think he's redone it, but it's also been replayed over the years. It's, you're able to purchase it if you go on, you know, if you Google "The Truth About Cancer." And I think that was the start for me anyway of these online webinars and summits. So they bring together everything that you're talking about, Dr. Getson, and they connect all of the dots. So if anybody has any question about what this is about, if this is about politics or money, or they don't believe that our medical system could be doing this, then I would encourage you to take a look at this documentary and decide for yourself. It's pretty riveting information, and they're bringing this information to us. You know, I would say that this is one of the things that I love about this age of information, because we have access to all of these, the greatest minds. You know, they're all doing these webinars and these summits that are free. You can have access to them free, listen to all of the speakers, get the information. And I would say also now, due to this online presence, the alternative, if you will, or holistic, if you will, practitioners, doctors, naturopaths are really galvanized, and there's a big movement going on now where these people are really They co-create. They help each other out. They're working together. It's a cooperative effort. People are. It's an inclusive group where they want to do is help each other and help people in general. So again, I encourage people to take a look at this. We're actually lucky enough to be going out to the live Truth About Cancer uh, conference in Texas, and that is in, I believe, the second week in October, which we're really, really looking forward to. Is that the correct date, Dr. Getson? Second week in October?
Yes.
Yeah. So take a look. There's also a wonderful, and I'm sorry for getting sidetracked, but I think this is important for people to know. There are places where they can talk with like-minded individuals. There's a movie called Thrive. What on earth will it take? And I encourage everybody to take a look at that documentary too. I've noted this in my upcoming October webinars, along with my October newsletter, along with some of the fantastic summits that are coming up. So sorry, Dr. Getson, but I thought that was a great place to let people know that there are places that they can go to get information if they're interested in more
I
information about
agree.
this. And you've listened to
I'm glad
part of
that
it.
you,
Yeah.
and I think that we should just add one more thing. Strangely and happily, I think the insurance industry is starting to recognize this as well, because people ask about payment and the charge for thermography. And as many of you know, the fee for thermography is $300 for the study and the report and a phone conference that may come associated with that. And we provide a universal claim form to individuals to submit to their insurer for reimbursement. 5 years ago, the number of individuals percentage wise getting reimbursed was about 10%. Now it's up to about 40%. And that jump of 30% to me indicates that the insurance industry is starting to understand what women want and what women are going to ask for and pay for. And I think they're seeing the handwriting on the wall. And this is a great indicator that things are changing.
And Dr. Getson, you're always saying that women drive medicine. And I think that this is a direct result of our fearless women sending in their claim forms to their insurance company and getting on the phone and talking to their doctors and saying, this is what I want to do. And I want it to be covered. And I think that they're creating this wave of insurance companies now covering. I mean, who would have thought that acupuncture would be covered by insurance? But it is getting covered by insurance. There was a time when chiropractic wasn't covered by insurance. So I think we're moving in the right direction.
I entirely agree. So just some additional data. Dr. Izzard, in 1972, about 6 years after the introduction of mammography and 15 years after thermography started, studied 10,000 women at Albert Einstein Medical Center in Philadelphia, about half of whom had a breast lump, pain, or nipple discharge. And he concluded that pre-screening with thermography would have decreased the need to expose women to radiation, mammography, by 77%. And further calculated that if mammograms had been done only after a suspicious thermogram, it would have produced a cancer detection rate of 24.1 women per thousand instead of 7. Okay, it should be 1,000 by mammograms alone. So it would have been a 3.5-fold difference without the radiation and compression.
Wow.
We talked in 1982. We talked about the FDA and the acceptance of thermography, the proper protocol for those of you who've never had a thermogram. The room is 68 to 71 degrees by protocol. We keep it at 68 to 69. The room temperature is constant with no flow of air onto the patient. Any air that may be coming in is deflected away from the patient. The windows are covered in such a way as ambient light does not come in. The patient sits in the room for 10 minutes disrobed to the body area that's going to be studied, in this case, mostly breast study. Pictures are taken in black and white and in color with a cold stress challenge in between to capture sympathetic response. And the study takes, from start to finish, about a half hour. Patients who should have a thermogram You see the list. The last one is my favorite. Patients wish to avoid radiation compression, which is pretty much everybody.
Mm.
The test is involving exactly what I said. Okay, 30 minutes, no discomfort, no radiation. It is done one on one with a female technician, and it is done in a comfortable setting, not the sterile atmosphere of a hospital mammographic suite. A study done in 1980 said that an abnormal infrared image is the single most important marker of high risk for developing breast cancer, 10 times more significant than a family history of the disease. So I repeated the first part of this from the study because the second part is equally important. And right now, despite what you were told and what you read in the literature, the incidence of breast cancer as a first generation disease, meaning mom or dad had breast cancer and you get it, is unbelievably, but accurately 4%.
Mm. And another very overhyped number.
Absolutely. The American Journal of Radiology 13 years ago said thermography could help prevent most unnecessary biopsies. It is a safe, non invasive procedure that would be valuable as an adjunct to mammography in determining whether a lesion is benign or malignant. This is a continuation of that article. Said the warning patterns seen by thermography have been found to resolve and return to normal after only a few short months of healthy diet and lifestyle changes. Now, this is extremely important as you will see moving forward. Thermography is the first tool we have that shows promise of being able to pick up breast cancers at so early a stage that involves only precancerous physiologic changes that women can reverse this change by avoid getting breast cancer. This just now, and avoid getting breast cancer by making a few simple diet and lifestyle modifications.
Wow.
I want to show you a couple of thermograms. I'm hoping that you can see the pointer move. Can you see this pointer?
Yes, we can.
Okay,
Yes.
great.
Yes.
So this area right here that looks like a diamond shape, the woman came in and she had a palpable mass. This was one of those situations that jumped out at us because she had a mass right where this diamond was. Here's a situation where it shows extensive heat, and this turned out to be a breast cancer despite a normal ultrasound and a normal mammogram. This is a patient that had 9 years of normal mammograms, 5 years of normal ultrasounds, and 3 years of normal breast MRIs, and found the lump and came in and said, I have a problem. I feel a lump. And we were able, by looking at areas to opposite sides, identify an area that had increased heat, which subsequently corresponded to her area of a palpable lump and ultimately led to a mastectomy. This is about 10 or 12 years ago. We do serial thermography, come back and let's check on an abnormality. This lady, this is the same lady. In this particular instance, the right breast was hot in this area. You can see the color down here, the yellows and green colors, which are warmer on the temperature scale over here. The blue colors are a little lower on the temperature scale over here. I had concerns about the temperature gradients and the heat and suggested that she come back 3 months later as well as undergo physical examination, some additional testing. She did not come back for another year. A year later, you can see how hot this breast is. It's astronomically hot, all the way up almost to the collarbone because the breast cancer that she had spread. And this is just how hot this breast is after a short period, a relatively short period of time of 1 year. We talked about earlier diet and lifestyle changes. Here's a lifestyle change where the woman on top had a lack of symmetry in the breast. This breast is warmer. This breast is cooler. This is the pre-studies on top. 13 months, a year after she stopped wearing underwire bras, you see that this is a virtually symmetrical pattern. And the only change that she made was to discontinue underwire bras.
Can we just talk one? I know we're getting close to time, but do you want to talk a little bit about why the underwires are dangerous?
Certainly, underwires do two things. One, they conduct electromagnetic fields. And number two, they compress the lymphatic system of the chest wall. And the lymphatics are necessary for the normal flow of lymph, the main body fluid. So if you're not having normal flow and everything becomes stagnant, the chances of pathology occurring in a stagnant area are increased greatly where the lymph flow is impaired.
right? So that's why we say ask that you don't wear an underwire on the day of your thermogram, and we do encourage people not to, as well as wearing antiperspirant. So it's same thing if you're putting an antiperspirant on, say you've just gotten in the shower, you may have shaved and may have nicked your underarm, and now you're putting an aluminum-based antiperspirant on under your arms. That aluminum can seep right into the body, as well as keeping the body from doing what it needs to do, which is to get rid of toxins by sweating. And so when you have a wire compressing your breast tissue, you're not getting the lymphatic flow that you need. We did a kind of an interesting experiment one day. We were out in the parking lot, or we were going towards the parking lot, and somebody with us had an underwire bra on. She put her car fob, that the thing that opens up her car, up to her underwire bra, and it opened up her car out in the parking lot. Do you remember that?
Yes, I
She
do.
didn't press. She didn't press it. It just conducted it and opened up her car door. So that was pretty amazing.
Pretty cool, actually.
Yeah,
Um,
yeah.
Full-busted women will say to both of us, I need an underwire bra. And the answer that we give them is buy the underwire bra and cut the wire out.
Well, a lot of women will say they need the underwire for support, but there are many bra companies out there now that make I think, a nice supporting bra without the underwire. And if you've got to wear the underwire, then get it off as soon as possible. At the end of the day, maybe give the breast a nice massage, get that lymph system moving. Sorry, I didn't want to get too sidetracked on that, but I thought
No,
it was
that's
important.
it's all very important information. Um, 4 months of gluten-free eating, you see the difference in the color views, which is actually a little easier to see than the black and white. You see this big area of hot spot right here as compared to the other side. You see this big area of heat here as compared to the other side. And you see that while it is still hotter in both of those areas, just simply making the dietary adjustment has caused that breast to cool down by reducing the inflammation, because gluten is a tremendously inflammatory food.
Hmm.
11 months after stopping caffeine, same thing. Here is this issue right here as compared to the other side, and coming down here is pretty much gone. Elimination of caffeine, sugar, and animal fats, the cool breast, the warm breast, and here almost a mirror image of one side to the other. 15 days. 15 days, this woman came in, had all these hot spots. This is the nipple right here. All of the hot spots, all this cool area over here. And she went home and just radically changed her diet. And I said, come back and see me in 3 months. She said, I want to come back and see you in 2 weeks. I need to know that what I'm doing is right. Look how dramatic the difference is from one side. Yes, she still has a couple of spots here, but look at the difference between the two sides. In two
It's
weeks,
amazing.
a year after starting, supplements, a year later, this cold spot over here is not present anymore. The symmetry of the breast has been returned. Homeopathics that took the heat from up here in the breast as opposed to this, and the heat down here in this breast as opposed to this, and this heat over here. And again, while you still have some heat here and you still have some heat here, it's just getting better.
So
Visualization of
they're
what
on the
you
right track. They're moving in the right direction. That's what's important.
correct. The classic picture is worth 1,000 word situation.
Yes.
Topical creams, from the difference here as opposed to the change here. And my favorite slide that we'll dwell on for a moment, this is a woman who got the top thermogram, had all these blood vessels, all these abnormalities, all the heat coming from the blood vessels, okay, and went on a diet. Took her about 6 months. She lost 50 pounds, began a daily exercise regimen, changed her diet, came back 6 months later, and this is the thermogram. And I'll be honest with you, when I saw this study, I thought it was a different woman. If you look, the blood vessels are pretty much gone. Fat is gone. Okay. Two of her three chins are gone. The heat in the breasts are gone. And this is just the most dramatic change that I think we could probably look at from somebody who looked and said, I am not going to do this. I am going to take this and be proactive in my own health concerns, and I'm going to make changes.
Yeah.
Um,
Fantastic.
for those of you who are familiar with Christiane Northrup, This is a direct quote from her.
Thermography is a breast health screening modality that actually helps prevent breast cancer, not just diagnose it early. I highly recommend this approach. And for those of you who know, Christiane Northrup is a big women's advocate. She has written many books, gives many lectures, and has a radio show on Hay House Radio, which Dr. Getson, I'll give you a little plug here. Dr. Getson is going to be a guest speaker on the Flourish radio show with Dr. Christiane Northrup on October 12th from 11 a.m. to 12 p.m. So you just go into hayhouseradio.com and you can tune in that day, or the interview will be archived. And thanks for letting me add that.
That is Christine Northrup and two of her favorite thermographic people. So I'm going to go rather quickly because it is 8 o'clock and I really want to get to the end. Other breast screening studies are ultrasound, which uses sound waves, and MRIs, which is a magnetic tool that pulls water molecules apart. PET scans use radiation, and CAT scan devices. They are a tool that allows you to determine whether or not a tumor, a malignant tumor, has metastasized or spread to other areas of the body. They do this by injecting a radioactive dye into the body and then letting a CAT scanner scan throughout the body. And the places where the tracer is picked up are the places that are suspicious for spread of cancer. Interestingly enough, what they inject into the body is a sugar-based tracer because cancer loves sugar. It is a highly radiologic procedure that it should only be looked at to determine whether the tumor has metastasized. Two other main uses for thermography: neuromuscular in patients with conditions like reflex sympathetic dystrophy, where you can look at the sympathetic nervous system and see that the left leg, and this is the left leg, okay, it does not perfuse because the nervous system is shutting down the blood vessels. So you have individuals who have chronic unrelenting pain, who have gone through a litany of diagnostic tests and all kinds of therapy, and sometimes the pain isn't better and sometimes the pain is even worse. And doctors will tend to throw up their hands and say one of two things: I don't know what's wrong with you, or there must be nothing wrong with you because I can't find it. And thermography will look at the physiologic responses of the sympathetic nervous system, give you a picture such as this one, and allow for a diagnosis and interventional treatment. This is another picture of a patient with sympathetic dysfunction and reflex sympathetic dystrophy. The fingers of the left hand are absent because they're so cold that they're not perfusing. It's a different patient, but the same disease. This is kind of an interesting study that Leisha did with a patient who had reflex sympathetic dystrophy. We took pictures of her hands. You see the difference not only in the back of the hand, but up here in the arm, where the temperature gradient is different. The left arm is cooler, the left hand is cooler. And every week for 5 weeks, she had a Reiki treatment and had nothing different. She wasn't taking different medicine. She wasn't doing anything different. But this is the picture before the Reiki treatment, week 1, and after the Reiki treatment, week 1, an hour or so later. And you see that the arms began to come into balance and the hands began to come into balance. And 5 weeks later, you see the before picture almost looks like the after picture. So we're talking about interventional treatments and diet and lifestyle abnormalities. You know, Reiki is one of the things that can be implemented to affect the healing. We look at dental issues. This is a situation where we know that there are a tremendous number of unresolved dental issues, frequently, very often, in instances where intervention occurred either in the form of caps, crowns, or root canals. So we found out by doing thyroid studies that there were dental issues that could be seen. This is infection in the lower right portion of the mouth that is handed over to the patient to go to their dental professional to see exactly which tooth and what it is that's an issue, because dental issues will not get better on their own.
And Dr. Getson, just let me tell people that the teeth that are connected to the mammary glands are on the upper right, tooth 2 and 3, on the upper left, tooth 14 and 15, and on the lower, tooth 28 and 29, and on the left, that's on the right, on the left, tooth 20 and 21. And so we have seen a huge correlation between people that have infected root canals or even infections with where crowns and caps are, and affecting their thyroid or breast health. In fact, I think the number is 82% of women that have breast cancer have a root canal. So it'd be very interesting to see if those root canals are on the mammary gland too.
I think take 30 seconds and just tell them about the woman that you saw with the line from the teeth.
Okay, so the way we started doing these thyroid dental studies was years ago. I was doing a breast thermogram on a woman, and I was looking at, I guess it was the color pictures, and there was such a pronounced red line, just a straight red line coming from her breast, and it was so obvious that she looked at me, I looked at her, and I just followed it up with the camera right into her mouth where she had an infected root canal, and she went to her dentist, had intervention. Thank God she went to a holistic dentist and had the proper treatment done, got it cleared up. We took another thermogram, say 6 months or so after the intervention, and the breast thermogram had normalized. And that was the start of us doing the thyroid dental facial studies, which have proven to be so helpful. I wish that every woman getting a breast thermogram would also get this, because as you said, if it's a dental infection, they can do everything in the world, but they need to get that dental infection cleared up if it's affecting their breast health, or dental infection can travel throughout the body.
Terrific outcome to that case.
Yeah, it was really nice.
A color view of a dental problem very quickly, the difference in heat pattern between the right and left side of the mouth. A patient whose head is actually tilted back, you can see the inflammation in the thyroid gland, and in this particular case, the temporomandibular joint as well. Also, you can see with the head tilted back, this is a massive dental problem. This is an individual who had an extraction of a tooth that had become infected with a prior root canal. And this is what happened 6 months after the intervention. You can see that the heat and therefore the infection and the problem was gone. We talked about diet and lifestyle alterations. This is a very beginning list of these. Gluten-free is important. Processed foods, white sugar, white flour, detoxification, filtered water, things that people don't think about, household cleaning products, the most toxic chemical in the world, Roundup, that we spray on the weeds because we want our gardens to look nice. Mental facilities, get relaxation through meditation, yoga, or things that make you happy. All kinds of different diet and lifestyle modifications. Okay. Another comment from Mike Adams. And with October this weekend, we have the beginning of the pink ribbon, pink washing campaigns, pink ribbons for everything. And so we put this slide on about all the neat things that are pink washed. And down at the bottom, you see it says, which of the products is really promoting breast cancer awareness? And obviously, the answer is none of them. I always ask people which of these products has any use. And my answer to that is the hammer, because you could hit yourself in the head and try and beat some sense into you if you believe the whole pink washing campaign. But they pink wash tasty cakes, they pink wash Dunkin' Donuts wrappers. I mean, the list goes on and on and on. So I'll leave it to you, Alicia, to read this.
It's time for all women to get in touch with her inner goddess, and let her direct the health concerns and not be misguided by the October pink washing campaign into making decisions that may be counterintuitive or in opposition to our instincts. Time to listen to our instincts.
And again, the symbol of the female breast, which...
And breasts represent the ability to sustain life through care, support, and nurturing. Breasts are often referred as mammary glands. They produce milk for offspring, keeping them nourished. This is where the word mother comes from. What a beautiful, beautiful representation of the female breast. Breast epitomizes the sacred feminine values of love, compassion, and wisdom. These heart-centered forces need to be cultivated and nurtured. Most of all, these heart impulses need to be expressed. When society objectifies and over-sexualizes women's breasts, it takes away from these fundamental values. So how beautifully put is that? So we have to, we're, as women, we're always willing to help and nurture others, but we have to also have self-love and compassion for ourselves and nurture ourselves. I think that says it all. Symbolism of the female breast.
It's a beautiful sentiment, and one which I hope everyone will share with other women. I think it's something that really should be uh, explained, experienced, and disseminated to as many women as can look at this. I think if the self-image changes, it promotes health as well as anything else that we can offer.
Yes.
So my last question and my last slide is this. Going into this, maybe there were things that you didn't know, and even if you knew something about mammography and something about thermography, I hope that tonight's presentation has opened some eyes, and I hope that you'll take the slides and download them and show them to other people, show them to doctors and healthcare practitioners. But the exit question is, now that you know, sometimes I start by saying, what would you do if you knew sooner? So the exit question is, what will you do now that you know?
It's an important question. Now that you know, you can't not know. So what are you going to do about it? Dr. Getson, thank you so much for bringing us this new information, for teaching us about thermography and enlightening us about mammography and the dangers inherent in that test. We so appreciate all the hard work that you've done and that you continue to do. We have a couple questions here. First, I'd like to say to Kevin, and thank you so much, Josie, for answering, Kevin. Yes, Kate Motz was supposed to be our speaker this evening. Unfortunately, as Josie said, due to unforeseen circumstances, she was unable to present. We're hoping to get her back in 2017 to present the information, because I know a lot of people were looking forward to it. Michelle asks, any other parts of the body where thermography works well? Are full body thermography scans done?
There's two answers to that question. In addition to the facial dental study that we showed, the neuromuscular studies are really for nerve injuries and for chronic pain. There are some people who will tell you that they can do thermography of the abdomen or the pelvis or other areas, and there is no medical science to support that. So we don't do them because I don't have the good feeling that I can be accurate in my diagnosis of that. There is a diagnostic tool called regulation thermography, which is entirely different than what we are doing, infrared thermography, that looks at organ systems. And that type of thermography, which is not available in this immediate area to the best of my knowledge, but still has the word thermography in the title, looks at organ systems for potential intervention to help improve malfunctions of different areas.
Okay, thank you. So it just in closing, everybody, our website is www.tdinj.com. Feel free, if you come up with a question later and you'd like to send it over and ask, we'll be happy to answer it. You can go on there. You can see all of our newsletters, all of our past webinars. You'll get to see our calendar of events. We've got about 10 off-site locations throughout Pennsylvania and New Jersey. Our main one is here in Marlton, New Jersey. I'm happy to announce that we're going to be starting up a new off-site on October 31st at the Chadsford Endermology Clinic, and that is in Chadsford, Pennsylvania. If you're interested, or if that's close to where you live, give us a call and we'll be happy to get you on the schedule. And as you know, your confidence in us is our highest compliment. If you find value in our webinars and our services, please leave a review for us on Google or Facebook. And you can find us on, as I said, website tdinj.com. Our phone number is 856-596-5834. So again, thank you so much, Dr. Getson. We appreciate you. We appreciate all that you do. And thank you, everyone, for joining us. Everyone, have a good evening. Thank you.